administrator.
And my name is Shine. I'm the Director of Nursing, and we are the Boss Ladies of C.A.R.E. So today we're actually going to be talking about a few things in regards to the month of June being National Men's Health Month, and we're going to be discussing a few of the top men's topics that are actually threats to their health.
So we have 3 topics that we'll be discussing today: cardiovascular disease, prostate cancer, and suicide and depression. So when we talk about cardiovascular disease, there are different types of cardiovascular disease. There is high blood pressure, which is hypertension, and high cholesterol, which is also called hyperlipidemia. And you can have a stroke, that's part of cardiovascular disease, which is also known as a CVA.
Or it can also lead to a patient or, a man having a heart attack as well.
Yes, a MI. So with that being said, when you think about blood pressure, your blood pressure should be below 130/90. Anything above that will lead you to have some symptoms of high blood pressure, and you might have to be put on the medications. With that being said, you have to go to the doctor, man. You definitely have to go and follow up. You have to take your medications. Just because your blood pressure is in the normal range, you also want to still continue to take those medications.
One thing, to piggyback off of what you said, you have to take the medication, but they have to get there first in order for them to know what their blood pressure is, in order for them to know what their cholesterol levels are, and in order for them to be prescribed medication. One of the big things is a lot of men are not fans of going to the doctors. They let symptoms, subside and, fight it out until they can't anymore. But if you're having any type of symptoms that are unnormal or unnatural for you, you need to go and seek medical attention.
So those symptoms might be a headache that you've had for more than 2 or 3 days, any swelling of your feet or ankles.
Also, if you're feeling dizzy, lightheaded, a lot of different things. If you're feeling, a lot of times you are the first person that knows that something is wrong. So if there's anything that you are feeling, like you said, that's not your normal baseline, you should be going to get checked. Headaches, if you have any blurry vision.
Chest pain, you need to go to the ER if you're having any type of chest pain, no matter if it's on your right side or your left side of your chest, or up in your upper quadrant area of your stomach.
A lot of people will complain and say that they feel like they have gas, and sometimes it may be gas, but sometimes it may not, so you always want to be on the safe side. Okay. So to wrap this part up, the biggest thing for us is to encourage our men out there to seek medical attention, try to exercise at least 30 minutes a day if possible, more fruits and vegetables.
If you smoke, please try to quit smoking.
That's about it for that topic. So next we can go ahead and move on to the next one. What would you want to do? Prostate cancer?
Yes. So prostate cancer, most men around the age of 50 get a colonoscopy, which is an early detection of prostate cancer. Some men have to get it earlier in their 40s. If they have any type of family members that have suffered from any type of cancer or any prostate issues, so you want to definitely get checked out for the prostate cancer.
So a lot of people don't understand why when you're at the physician's office, they usually, when you're filling out the form, it asks you, do you have any family history of these particular diseases? But the reason that they're asking you this is so they know how early they need to do certain testing for certain diseases. So as Sharita was explaining, at the age of 40, they generally want you to test early at the age of 40 for prostate cancer if you have one immediate relative, like a brother, a son, or a father who was diagnosed with this particular cancer. The age increases some depending on other risk factors. They will wait until 45 if someone actually does have the cancer in your family, but it's not more than one.
Right. And also, if anybody in your family also has any type of cancer, they want to look for any type of cancer, such as prostate cancer. So.
Right. So for the age of 40, it's if you basically have one or more of those immediate first degree relatives is what they call them. And then
45 is one.
Right. Or if isn't it within like the normal, I mean, if you're African American male,
yes.
They usually want to check a little sooner, so at the age of 45.
And 50 for all other males. What we want to remember is that men are at higher risk for diseases than women from birth all the way up into old age.
So a lot of things can be, treated more successfully with early detection. And in order for early detection to happen is by you seeking medical attention.
Yes, going to the doctors. And so that moves us on to our next topic, which is depression and suicide. So a lot of men don't deal with depression and suicide very well. They hide their emotions. Most men don't cry. They end up acting angry or aggressive towards somebody, and that's showing their emotions of depression. A sign of depression in men a lot of men tend to, like I said, act aggressive or angry. But also, the other side of depression is sleeping, doing stuff out of their normal activity. Sometimes they call it midlife crisis. Sometimes with men, where they go out and buy expensive things, such as cars, to make themselves feel better about the age that they're turning.
But as Sharita said, I mean, sometimes signs can be described as the opposite of them. A lot of times they might normally be full of energy and wanting to go out and do different things, but now they seem more malaise and fatigue. They only, want to sleep, or they don't want to be bothered, and they don't want to, have any interaction with some of the normal people that they generally talk to on a day-to-day basis.
And also, a big thing with depression is suicide. Even though most women attempt suicide more often, men succeed in completing suicide more than women. And suicide is the 8th leading cause of death in men. And it's a little bit higher for younger men and for older men. So you want to make sure that you are paying attention to, if you're feeling depressed, seek some type of medical attention, preferably a therapist. You don't have to take medications all the time for depression. Sometimes just talking it out may help a little bit better.
That's absolutely true. And the one comparison, as Sharita stated, that a lot of people noted that women have the most amount of attempts, but it's the men that are most successful. And the difference in some of the symptoms that are shown between the men and the women, for women, I mean, it's usually where they're more tired, emotional too, crying, and things like that, whereas for the men, they feel like being
angry and aggressive.
It's easier than them expressing their feelings. And they might drink
more also. So you have to really make sure that you're paying attention to your health. So with that being said, with our male patients, we have licensed professionals that go out and check their blood pressure, make sure they're taking their medications, and if their blood pressure is out of their normal parameters, they will contact the physician to make sure that the physician knows and if they need any new recommendations.
Right, so it's basically an attempt to prevent the patient from being rehospitalized. So the nurse will right then and there contact the physician while they're in the home, let them know what the patient's readings were and what the physician's parameters are in order to get an intervention in place right then and there.
So with the prostate cancer, our professionals will go to your appointment with you. They'll even help you schedule your appointments for a prostate check. So there's no need to be afraid to get your prostate checked, because somebody will be there with a caring hand to make sure that you're taken care of.
Because we really do care.